from a medicine standpoint, I'll say the same starting point is from where Richardson started in 1916 with barometric pressure, wind, and temperature. We've had blood pressure that we've been able to measure since the 1880s. We do an electrocardiogram, which was first developed in 1901, and at that time you had to put 2 legs and 1 arm in a saltwater bath. So we're much better today, but really the current 12-lead EKG was perfected in about 1940, and really just the equipment's gotten better, but the 12-lead is not changed. And then we've had a stethoscope. We just recently had the 200th anniversary of the stethoscope, but the stethoscope that we know well with the bell and in our ears and the tube in our ears has really been around since about 1850, so about 160 years old. And this is, we've had then really well over a century of our main tools for managing outpatients in the clinical setting. And unlike weather forecasting, though, it hasn't changed a whole lot. So I'm using my TV character's medical office visit. So in the United States, the average American will see a doctor about 3 times a year. In that, they'll see the doctor for about 10 minutes for each visit. And it takes about, the opportunity cost of just for that visit alone, not including scheduling everything, is about 2 hours to drive there, to wait in the office, and to see that individual. And then you get to the office visit, and in my clinic, I'll take your blood pressure, I'll probably look at your EKG, and I'll listen to you at the stethoscope. Pretty much no different than what a doctor would have done in the 1920s for chronic condition management. And really, this is kind of still state of the art today. So what we're missing in this opportunity is, so you have about 30 minutes where a doctor spends with a patient on average in the United States every year, but that leaves about 5,780 hours of completely unmonitored awake time every year. So times where that individual is being exposed to either pathogens or the environmental or just work stresses and other things that we have no idea what's going on because we just see them for these very, very brief snapshots of care. And these are one of the ways where I think not only can digital medicine make healthcare more convenient, but it can also allow us to much better understand what's going on for our patients in a way that allows us to be much more prevention-oriented rather than sick treatment-oriented. So of the many things that haven't changed over the last 100 years in outpatient care, one of the disappointing things that's changed is that we don't really take care of patients where they live anymore. So in the 1930s, about 40% of all patient encounters were in their home, and today, at least in the United States, it's well less than 1%. And again, that's something that I think digital medicine can address, and I'll give some examples of how that is. And this could add to the convenience, and I think for a lot of physicians also, the satisfaction in caring for patients. So let me go through a little bit of how the technology or the capabilities of what we can bring into healthcare have changed just in the time when I was a cardiology fellow, which I started in 1995. So when I started my training in cardiology, the world's fastest supercomputer was this ASCI Red. It cost $55 million to develop, and it used the electricity of about 800 homes. Today, there's a mobile chip, which is just as powerful, that is not yet in any smartphones, but will be soon. So now we're going to have the majority of the world's population can have the same capability, computational capabilities, as really no one was able to have except maybe US government workers, whatever they used the supercomputer for back in 1996. During my cardiology fellowships, the big breakthrough in cognitive computing was IBM's Deep Blue beat the world chess champion Garry Kasparov in chess in this very kind of one-dimensional, very computational heavy, but not necessarily the multi-dimensions of really what we think of as cognitive computing capability and artificial intelligence now. Now, anybody can download that same chess-playing computational power in a smartphone app, in fact, one of several smartphone apps. And we know in cognitive computing we've moved far ahead IBM Watson's in Jeopardy Champions, a very popular game show in the United States of general knowledge, and then the Google AI's beating the Go champion. And so we've had come remarkably leap forward in our capabilities of cognitive computing. And then finally, we've really, the ability to be connected. So people to have connection to not only each other, but to some of the world's most well-known experts in healthcare through the internet. So when I was a cardiology fellow, 0.4% of the population used the internet, had access to the internet. Now, globally, it's about 40%. In the US, it's a little bit less than 90% have internet access, and it's growing. You can see by the graph, the growing orange line, is that for more and more people, their primary access to the internet is coming from smartphones and tablets, so mobile devices. And that's continuing to grow, and it's growing all over the world in low-income, middle-income, and high-income countries. And so in the very near future, essentially everybody's going to have access to computational power that virtually no one had access to 3 years ago or 30 years ago, to cognitive computing capabilities, and access to healthcare expertise that they've never before been able to have. And that's really what's driving this disruption that digital medicine can bring about. I'm going to just briefly talk about genomics, and that's another tool that has changed since the time I was a fellow for the Human Genome Project. First announced, the sequencing of the human genome in 2000 at a cost of about $100 million, and now it's down to about $1,000. You can see just this dramatic decrease in overall costs, and it's still sinking. And so the ability to do more and more genomic testing is becoming more common, and it's become more available, and that's going to allow us to learn more. And you can see that the total number of individuals who have had whole genome sequencing is exploding and taking off exponentially. And it's leading to a fascinating kind of problem around data storage and data handling capabilities, that when you think of the really big data handling needs of like astronomy, Twitter, YouTube, that genomics is going to far eclipse that in the very near future. So as we continue sequencing, and so it's going to lead to a phenomenal revolution in data analytics, as well as our understanding of medical technology. So let me focus on digital technologies and kind of say what we can do and what's capable. This is going back to a cartoon from 1960s, where somebody was kind of dreaming of this fictional suit, an instrumented suit that allows you to measure heart rate, blood pressure, breathing, and temperature in a checkup in just 1 minute. And this was looked at as somewhat fanciful, but it's still kind of a nuisance, and you can see a doctor's there in front anyway. And I'd say we have that technology today. This is a device, and this is a company that I'm an advisor for, and it's called a DynoSense device, and I'm not going to demonstrate it, but I'll just show you the size. So this is the device, and in about, less than 20 seconds, it'll measure my blood pressure, my heart rate, an EKG, my temperature, my oxygen level in my blood, and my respiratory rate, and it'll track all of that for me. And then I can share that with my doctor, or I can just track it for myself. So this capability of doing this 1 minute measurement of our vital signs in a doctor's office directly hooked to a computer has been leapfrogged to a little handheld device that anybody can have, and it's connected to my smartphone, and it takes advantage of this computational capabilities as well as the connectivity. And that's just kind of one example of, there's almost an unending opportunities to take advantage of different technologies, and it's really not based on what the technology is, but rather what's the medical problem you're trying to solve, and whether the technology exists for that. And I'll just give some examples. So I already mentioned that really we don't track our patients outside of the very few times, the very limited amount of time we spend with them in an appointment. But if we wanted to track their symptoms at home and just see how they're doing and kind of keep track of that, there are multiple different patient-reported outcome measuring tools. This first one just happens to be for people who have sleep problems, to kind of track their sleep and how they're doing, and maybe what's contributors before they went to bed that may make their sleeping more difficult. This is another that's more specific for asthma or other respiratory problems, so people are able to track symptoms like chest tightness and wheezing, as well as abdominal pain, and others, and can track it on a day-to-day basis so you can see how they're doing. And then also there's a lot of mood and mental health focused apps where individuals who just want to track how they're feeling, see what kind of maybe their environmental stresses affect them, and what's going on. You'd be able to track that on a day-to-day basis too. And these all kind of require active input, but I think that a lot of these all the sensors and technologies are really going to be making them as passive as possible. This is one example, a platform called Ginger.io, which tracks mental health primarily by tracking your level of normal communication and activity. So it learns how often you email, how often you text, how many phone calls you routinely make, how often you're involved on Twitter and Facebook and the like. And then it looks for signs of a decrease, that you're becoming more and more isolated. And it also connects to behavioral health specialists to help you through that. And there's more and more technologies that are designed to kind of passively follow you and act as a safety net to really only kind of bother you when there's something actionable or when you want to get information from it. There's also a wide range of home diagnostics, so for any acute conditions so that people don't have to go to the doctor's office or to a clinic, and ideally never to an emergency room for diagnostic tests. This is just a simple test that's undergoing FDA approval right now for home diagnostics of urinary tract infections and other urinalysis, where it looks like a lot like a more fancy dipstick for urine, but it uses a smartphone to take a picture and give you information about what it means and what's going on, and whether you have signs of infections or if you have protein in your urine or other findings depending on what you're looking for. This is another technology that allows for parents who have children who have recurrent ear infections, that instead of waiting to take your child to a pediatrician in the morning, you can snap on, it's called a cell scope, you snap it onto your smartphone, and you can take a picture of your child's eardrum, and then you can send it to either your doctor or you can send it to a virtual health platform where they can give you feedback. And there's also, and I'll give examples, any kind of imaging processing that's really supported by artificial intelligence. So in a way, you can choose. You can say, okay, I just want a computer reading of this, or I want a physician to read this, and you can select what it is. There's several companies making home blood test diagnostics. So it'd be finger sticks, but beyond glucose, very much like it, but electrolytes, hormone levels, thyroid levels, a lot of different, pretty much any blood test that's possible. They're developing strips to put in these tests, and you just need a finger stick of blood. This is a but a point of need genomics test that we've studied in Africa for infectious disease diagnosis. So this again requires a finger stick of blood, but it does a genomic analysis that you can do it around pathogens, around virus or bacteria, but you can also do it if you want to do a pharmacogenomic analysis and see if somebody's going to have a reaction to a specific drug. You can do in a pharmacy or in a doctor's office that, and soon we think that would be available in like local pharmacies, so you don't have to go to a medical office, but it'd be more convenient and get a diagnostic test for infections. And then something that I think will become very big in the future, although there's a good amount of work to do, is breath analytics. So we've known for a while, thanks to dogs, that if we are sensitive enough, so if we can determine different chemicals in a part per billion range, that we can diagnose things like cancers, infectious diseases, other conditions such as asthma exacerbations and heart failure exacerbations. There's been a lot of studies that have done informal lab testing with mass spectroscopy and gas chromatography. But there are several companies developing these handheld breath analytic devices that are getting better and more sensitive. And so it's not hard to imagine in the not too distant future that instead of like yearly mammograms or every 5 years colonoscopies or other cancer screenings, you can just do a simple breath test at whatever frequency is right. Maybe it'll prove to be once a month, but ideally you'd be able to diagnose cancers much, much sooner. You could also use it for infectious disease diagnosis. They've done some early studies on strep throat, something as simple as that, but also more sophisticated studies around tuberculosis and malaria. There's also a slew of lifestyle and behavior changing technologies that it's still questionable how well they work, but it allows us to try different things, to try different incentives and see what does work. This is a medical grade device. Most devices are just consumer grade devices, but they're getting more and more similar all the time and better and better. So you have Fitbit and Apple Watches, you have a Withings device and a Mio device. You also have even rings that measure, so it doesn't have to be a wrist-worn device to measure activity and sleep and heart rate. This is a ring out of Finland that does all that, and they've compared it to a formal sleep study, and it's just as effective at diagnosing or at identifying deep sleep, light sleep, REM sleep, and total sleep duration, all in a ring. So there's going to be more and more technology being developed around that. And then finally, in a large category of physiological monitoring, either continuous or intermittent, one of the more popular mobile digital devices is the AliveCore EKG, and there's several other handheld EKG devices. They have both the smartphone-based, and then if you have an Apple Watch, they have a wristband that you can touch the wristband and create an EKG. And I find as a cardiologist where it's always been in the past really frustrating to diagnose patients who have palpitations because you'd have them wear a 24-hour Holter monitor and you would often miss it. They would, more often than not, they wouldn't have the symptoms while they're wearing it. But to have something like this, then anybody, anytime, it could be 2 months after you give it to them, could be 2 years after you give it to them, but when they have the symptoms and they have their phone with them, they could take it out and record an EKG and you can know what's going on. And and very soon they have undergoing regulatory review a 6-lead EKG, which is almost just as easy to do. So instead of just holding it in your 2 hands, you hold it in your 2 hands and press it against your leg at the same time, and you get a 6-lead EKG, which would be much more effective at diagnosing ischemic changes or other changes that might be affecting overall conduction. There's patches that can record the EKG really easily for up to 2 weeks that patients can place themselves, and then there are patches where it transmits it continuously, or others where they can just mail it back in and get those results. There's a plethora of blood pressure monitoring devices, many blood pressure cuffs, but others that are the non-invasive. The technology of this device is non-cuff based in measuring your blood pressure, and it's just the first of what's going to be many, many more devices, and many devices that eventually can measure it continuously. This is a wrist blood pressure device that is a cuff. It's small enough, it essentially looks like a bulky watch, so like a large diving watch, and it's by Omron, and it's just got FDA approval. Or it's undergoing FDA approval that they think they'll get in the next several weeks and become available where it's going to be easier and easier to measure blood pressure. And then when you think of blood pressure, really, for 1880, when it was first determined, the idea of, well, we're going to blow up a balloon and crush the artery until we stop all blood flow, then we're going to listen to it as we release that balloon until we hear the cross-cough sounds again, and that's become this established, but maybe that's not the best way to look at vascular health, and so several companies have developed different technologies. This is a scale that, besides just measuring your weight and your fluid percent water weight body fat. This also measures your pulse wave velocity as a surrogate for blood pressure. So every time you just step on the scale, you get heart rate and pulse wave velocity as well as weight and other things that you're used to. There's another scale by another company that also looks at your calcium, your overall calcium content. How it does that, I have no idea, but it kind of replaces a DEXA scan. And so more and more these very simple technologies that are going to allow us to kind of monitor our patients in their homes and keep a much closer eye on them and much easier or much sooner determination of any kind of decompensation in their status. And then for more specialized settings, this is a necklace-like device that is designed specifically for heart failure patients. It measures the amount of fluid in their lungs, as well as their cardiac output, their blood pressure, and an EKG, and it transmits it to their physician's office. They typically asked to wear it twice a day just to see how they're doing and to follow them. And then many more devices that can help mostly passively monitor different physiological measurements. A really exciting area is sweat analysis. Too, there are several universities that are developing these decal-like patches that stick on the skin and then can measure continuous changes in the composition of sweat and then correlate that with your plasma concentration. So most studies have focused around electrolytes, lactate level, cortisol levels, and those are becoming better. They transmit, just that patch you see on the wrist there transmits that information continuously to the smartphone where it's captured and then can be sent anywhere in the world. And then there's a contact lens that right now is being developed to measure glucose in your tears as a measure for your plasma glucose. And so it's a non-invasive way to continuously measure glucose. And there are other contact lenses designed to measure intraocular pressure in patients who are worried about glaucoma. But if that proves out, there are going to be more and more kind of tear-based sensing technologies through contact lenses. So just as an example, we're fortunate at Scripps where we get to work with a lot